Have you ever been on a flight and there's been a medical emergency? The flight attendant says, "Is there a doctor on board?" Welcome back to Rohrich Knose, helping make you a better you. Yes, I've been on many of those flights. I've flown over 3,500 flights, but also over 3.5 million miles around the world. And yes, I've been involved in 8 medical emergencies in flight. And so I'm quite familiar with that. So let me tell you a little bit about some of the basics and some of my experience in managing some of these in-flight emergencies. They vary a lot. Depends where you fly and what airline. And I'm not going to mention any specific airline because I've flown most of the airlines, not only in the U.S., but globally. So, but the common things are syncope. In other words, you fainted, or somebody's nauseated and have vomiting, or some shortness of breath, and then it gets a little more serious, chest pain, seizures. And it isn't that common. The statistics are are hard to get. It's like 1 in 400 to 600 flights, but I don't know. I seem to be on some of those flights. And yet, it's been said that up to 70% of at least American flights, USA flights, have an MD on board. But only 7% of those medical emergencies are considered serious. Now, what is serious? It means we have to land the plane. We have to do something pretty drastic online. And I've had to do sometimes I've had to do some things that required a little more expertise. Remember, I'm a plastic surgeon. And, I'm a physician, I'm a surgeon, but, we're doctors too. So just so you know, I think it's been since 2001, all airlines, U.S. airlines, have to have a medical kit. And they have to have certain equipment. I still think they should have more. But internationally, it varies so much to almost nothing. So the bare minimum is they have to have some vital sign equipment. They have an oximeter, blood pressure cuff. They have a stethoscope, something you can put around your ears so you can hear the heartbeat. And BCLS, basic cardiac life support, is required of all flight attendants in the United States. And they have to have an AED on board as well on American Airlines. Now, on American USA Airlines. Now, I recently was on a flight and they didn't have an AED where I needed it. And they have limited medical supplies. And so just know what? So what do you do? When somebody says, "Is there a doctor on board?" And of course, I think as a physician, you have a duty to stand up. Although I must say, sometimes I've stood up and then all of a sudden there's 3 doctors around me, and many of them have far more experience than I have, at least I think they have. So it's your obligation. Now, if you've had a drink or not, then I think you should not do that. But I think that common sense rules. And remember, you're covered by the Good Samaritan law, which means that if you're doing something out of the goodness of your heart and your talent, then you are protected. And, respond if you are able, and be safe and be logical. And the first thing is take your own pulse. I've done this numerous times, so I kind of know what to expect. The first thing is, you surround, you ask for help. Okay, and you want to see the medical equipment, the medical kit, and you want to ask for the senior flight attendant, okay? This is not a time when you want to have an amateur hour. And then you want to assess the patient. And you will have enough time to be in contact with the ground medicine team and the captain is usually a phenomenal person, and often I will talk to the captain because they will listen to you. So, and this has been mainly on American flights. So remember, BCLS, basic life support, is required of all attendants, and so the key is just make sure that you get the help you need. So let me just give you an example of what happened about 6 months ago. I was going from Miami to Dallas, and I was halfway across the Gulf, and all of a sudden they said, "Is there a doctor on board?" And so I go back, and of course the person's in the middle row, a packed flight, and he's seizing, and which means that he's having a medical seizure. So
luckily, I had 2 volunteers that actually helped me pull the gentleman out of the seat and put him on the floor, because I didn't want him to aspirate, which means that you swallow your own saliva. So he stopped seizing, and he was really, took him a while to actually be able to respond. So you do the ABCs: airway, breathing, circulation. And luckily, we had an oximeter, and we could do his blood pressure, and I could assess his breathing. And then a nurse helped me. So always surround yourself with as many medical staff that are there to help. So this nurse was phenomenal. She actually happened to be a neuro ICU nurse. So she helped me, and we put an IV in the gentleman. We gave him glucose. I think he was hypoglycemic. And then I could get a history of, did he have, I think he was dehydrated, and he didn't have diabetes, but he obviously probably had been out drinking the night before, so he was dehydrated, but he had seized. That was a true seizure. So I then talked to the medical team that was on the ground. It was in Dallas, and everything was under control. And I looked at the medical kit, and so those are the things that were very important. But the key was that we stabilized this patient. We made sure his vital signs were okay. And of course, the nurse was awesome. And I think that that's the most important thing. You want to make sure they're stable. And because, in this flight, they had a blood pressure cuff, an oximeter, and the consciousness was good. And after his first seizure, and he was lying on the floor, he was okay. He was stable. And we were halfway across the Gulf. So, of course, I talked to the captain, and he said, should we divert? It was equal time to New Orleans or Dallas. So if it was equal time, just go to Dallas, and he was fine. So, and the patient was talking throughout the time. In fact, he got better as we got going and got on the way to Dallas. And of course, the good thing is they will call ahead, and the medical team is there to meet the plane, and everybody stays on board. And we brought the patient up to the front. In this case, actually, he walked, and they took him out on a stretcher, and everything was fine. Doesn't always go that way. Okay, so there are other times when I remember. This was several years ago. I was on a flight from Japan to Korea, and halfway across the ocean, we were mid-flight to Seoul, and this gentleman arrested in first class. And so we had to institute CPR, and we did CPR for about 45 minutes, which was about an hour out, and we could not get him back. And, we did not have an AED, but so that was not such a good outcome. But we did all that we could with the things that we had. And turns out that, of course, he'd had cardiac disease, he was a smoker, and he'd had multiple different heart attacks before. And then we were met at the Seoul airport. So I think, those are all things that, you're there to help as a physician, as a human being, and to make sure that you do everything you can humanly possibly do to help your patient. Because, we're doctors first. I'm not just a plastic surgeon, and I'm a physician first. So I think, being in flight and having a medical emergency is really, I don't think, that uncommon. And I think it's reassuring, when you can help somebody and get them safely back on the ground. And I think so do the passengers. It gives them a feeling of relief. And I will tell you, except for one exception, the team, the airline team, the staff, the flight attendants are phenomenal. They are great. They're there to help you. Sometimes a team on the ground that is giving you advice may not always perhaps give you the best advice that you may need to do, but they're there for you. And I think that the captain is, of course, is in charge of everything, and they've always listened to us when I said we need to land or we need to move forward. So sometimes I've had, on a flight about 2 years ago to Chicago, I had another gentleman that actually just passed out. And again, we put him on the floor, And this gentleman was hypoglycemic and he had diabetes, and so usually if they haven't passed out, you can give them orange juice or even a Coke. Man, that's got so much sugar that'll wake anybody up. So you can give them a regular Coke, and this person didn't. So I had one shot with one little IV, and I got it in and I gave him some glucose. So that's really helpful. And again, those are just another example. And then the common things are if somebody just passes out. I think the biggest thing to do is, if they're lying flat, elevate their legs, get their, because when you elevate their legs, you're going to give them like 1 or 2 units going to their head, and they've just passed out, and then they'll usually come to, especially if they have a pulse, then you can get their oxygen level. They usually will wake up, and then of course then you can talk to them about why they had that level. And now the other thing that's not commonly on in its equipment is antiemetics, anti-nausea meds. They're not on most flights, so just make sure of that. Now, the other thing is sometimes people will have Benadryl, so sometimes if you need a medication, I remember one time we needed some Valium, and of course you wouldn't believe how many people had Valium and all other kind of meds that they were willing to give the patient. So, just ask, and I think that's something that people are always happy to do, and it kind of is very, it's very reassuring to people. There's still people out there that care and that really are good people. We always hear the negative things, but I can tell you, when I've ever had these on in-flight emergencies, I've met some incredibly nice people that really cared. That weren't even in medicine. That helped. But so always ask for help. Make sure you surround yourself in a safe area, and be in contact with everybody. And I think that's important. And some of the things you can do, when there's a cardiac emergency and a patient has a cardiac, chest pain, they do have aspirin, so you can give them a couple of aspirin, and then also even nitro. They have nitro tablets on, and so they can do that. And sometimes they'll have an EKG if there's an AED on board, but most of the time they really don't. So I wouldn't bank on that. And I think the other thing that's very important to understand is, do you know how to do CPR? Everybody needs to know how to do CPR. It's really something that not just our flight attendants should do, but it's something that everybody needs to do. The aim is to do 100 to 120 compressions, just in the mid-sternum, and you want to put one hand above the other, and you want to press down at least 2 inches, to get adequate compression. And the thing that's changed is that the breaths aren't as important as much as the good adequate compressions. It's 30 compressions, 2 rescue breaths. But if you're alone, I think the compressions are by far the most important until you get a rhythm, and then you can do the AED. Now, and that obviously will require somebody to help you. So push hard, push fast, aim to do 100 to 120 compressions a minute. And do that, and I think that really will help. And obviously, this is where you need other people to help you, because you're going to get pretty tired pretty quick. And so you can do that and assess them at 2 minutes, and do they have a pulse? And then if you have an AED, you can hook it up, and then you can potentially shock them. And I think that's very important to do. So I think the basics of ABC are important. I think getting people around you, making sure you're in a safe environment, getting the most senior flight attendant, getting senior other people ask for help, nurses or other physicians that are there. Sometimes people are afraid to speak up or to help, but when they see somebody else helping somebody that's in need, they will help you. And that happened to me on another instance where I really needed somebody to get a passenger out of the middle seat. And it was another passenger that actually helped me do that, and it was another patient that had passed out, and this was a big person, so they helped me pull it out, and then it turned out that individual was a physician as well. So sometimes you're surprised, and I think then they can help you. And I think no one should feel like they can't help, and we're a team, and so once you stand up and designate yourself as a physician, you are the team leader, and they will listen to you. But and do safe and logical stuff, and always, like I said, make sure that everybody around that patient knows what you're doing, and that if you need to land, I will tell you that the captain has always, in the times that I've had to do that, is always obligated. And because we're all there, because we're human beings, we want to do the right thing and be safe. So I think that's just a very brief overview, and I welcome your comments and questions and thoughts about this. I'm sure many of you have probably been on a plane when either you've seen this in action, or you've seen what's happened, or you would have liked to see it handled better. I mean, all those comments are very important to me, because these are one of these things that help make you a better you, because it'll make you a more educated you. And certainly, the basics of BCLS, basic cardiac life support, everybody should know that. That's very, very important to do. Okay? And so I would say those are the cardinal rules, the ABCs, and safety, and, getting help, and making sure that you are doing the right logical things for you. It's really, not only as a physician, but you're being a good Samaritan to help a fellow human being. So I encourage you to ask any comments and questions, and hopefully this segment has helped show you how you can help when you do face or have an in-flight medical emergency on an airline. Thank you again so much, and we'll look forward to seeing you at the next Rohrich Knose podcast, making you a better you.